Hi, I'm Barb Grzywinski. Today I'm at Strockview Dairy with Ryan Gartman, Kyle Strock, and Dr. Brandon Debbink from Dairy Doctors. We will be discussing lung ultrasound technology today and the benefits that Ryan and Kyle have seen and the benefits that Dr. Debbink has seen for his customers. So, a little history about Strockview Dairy. Several years ago, they decided to switch from milking Holsteins to Jerseys. And at the same time, they wanted to raise fewer heifers because they had two different farms they had heifers on. They were spending a lot of labor, a lot of heifer raising cost to have all the heifers on this farm and two other farms. They wanted all the heifers on one farm, so they started limiting the number of females born. So by doing that, with a limited number of females, they need to make sure that each female was very healthy. So the first thing they did was switch to Amplifier Max with gut health technology to reduce scours and reduce mortality. And they were very happy with that move. And now they're still looking to keep a healthy female, and they've decided to start using more technology. So Ryan, can you tell us why you decided to start using the lung ultrasound technology?
Didn't really feel like we were having a major problem when it comes to respiratory illnesses. We just want to make sure we're doing everything we can to prevent it. So in the past, I'd sat in on some seminars and talked to some of the vets about it, and I was very intrigued by it and the technology with it. And so that's a lot why we wanted to go that route, was just to reassure that those few calves that we are keeping, that they're going to maximize their health and their ability to perform for us in the future, is really what it kind of boils down to for us.
And then Dr. Debbink, can you tell us what is involved in doing the lung ultrasound for what you do and for what you do for the dairies?
Yeah, so typically what we're trying to do is identify these calves before they show clinical signs of pneumonia, and of those calves that, are they going to show clinical signs of pneumonia to the point where we would identify them for treatment. So typically what most herds I have doing is 2 scans before weaning, pre-weaning, to try to basically keep those lungs clean before they wean. The biggest benefit I've seen on most dairies is that we end up with a lot less post-wean slumps in terms of these calves that get treated a week or 2 after weaning or grouping. And I think a lot of that has to do with these residual pneumonias that just aren't getting identified in the pre-wean stage. And we can get those treated appropriately, not only at the right time, but also in some cases with the right drug with some other technologies as well. Obviously we're looking in terms of prevention. This is entirely detection, but it helps us prevent some of those post-wean pneumonias. Obviously vaccination and moving some things around nutritionally can always help as well. The big thing, is just identifying those pneumonias and where we're going to have the best bang for our buck in terms of that antibiotic treatment. And the big thing is treating those calves at the right time, to have the best success in cleaning those lungs up before weaning.
And Ryan, what have you seen here at your dairy from working with Dr. Debbink and your calves?
We found that it's definitely made it easier a little bit with some of our management now. We did in the past, if we did have a couple cases in the past, we'd often see it when they were already in the groups. And we kind of thought maybe we were having issues with ventilation or bedding or things like that was causing illnesses in our group housing. And now after doing the ultrasounding, we kind of find out they were already carrying the problems before they got there, and now we've been able to identify this, so we've now reduced the problems that we see in our group housing now compared to before. And the nice thing too is all this is being stored in our dairy comp, and so we have records to follow with each calf, and then we can also follow that data as we go forward, and we can see, is there certain times of the year where we see highs and lows, or if all of a sudden we start seeing a trend coming, and over time, then it'll open up those discussions that we can have then as far as, where is it coming from? Is it environmental? Is it, viral? And we can sit down as a team and kind of go over that and decide, how do we fix that issue and head it off before it becomes more severe? Because like we had said in the beginning, with limiting how many heifers that we're going to raise, every heifer becomes very important, and one loss is too many, when you're going to really be tight on how many you keep back. So that's, another some of the pluses that was doing this.
So I think we've been doing it for 2-3 months here right now. And what would you say the benefits you've seen already?
Like I said, we've seen earlier detection, so we've been able to get calves to get a quicker response, and any calf that doesn't respond well to the treatments, we can just eliminate them from the herd and cut off our costs and expenses on an animal that's never going to live up to our standards now at this point. And be able to, like I said, any calves that we do get early detection on, we can treat them, get them over it, and keep them moving so that they continue on and stay in the herd then. So we have seen a number of calves like that we've been able to have success with early on, and that's helping as we go down the chain.
Dr. Debbink, what have your other clients seen from doing this?
So every client utilizes the technology differently. Because what Ryan was talking about earlier, we have fewer females hitting the ground. We need to protect that investment, make sure that we're raising the best replacement possible. Other herds will use it strictly for culling, finding those calves that maybe missed treatment or beyond treatment, that aren't just going to reach their potential. And the last one is probably just for population epidemiological analysis and seeing exactly, finding where these calves are most affected, and then putting in different sort of management strategies to try to mitigate that risk, whether it's vaccination, nutrition, environment, or housing, or even colostrum management as well. So I guess that's the biggest thing I hear on most dairies is like I said before, those post-wean slumps. We see a lot less of those. Obviously we have to make sure that nutrition, colostrum, and all those other things are in place first. But then along with that, just decreasing the amount of antibiotic use.
Thank you for your time. And if anybody has any questions, contact your CP representative or Dr. Debbink at Dairy Doctors. He'd be happy to help out also. Thank you. Have a great day.